Hi, welcome. I'm Jan Marini, the founder of Jan Marini Skin Research, and I'm here with Patti.
Hi.
Patti's here for a consultation today. So Patti, I'm going to ask you a few questions. If there was something you could change or improve about your skin, what would it be?
Probably, well, of course, the lines and the wrinkles and the sagging. And I'd like to have a little more evenness in my skin tone.
Anything else you can think of?
I get breakouts, as you could see, like once in a while. Mm-hmm.
And the breakouts are usually on the jawline area?
Correct.
Okay. And do you think, how would you categorize your skin? Would you say it's more normal, combination, dry? How would you categorize it?
It's pretty normal.
Okay. And so do you have any areas where you feel that you're more dry or more oily?
No, not really. I think I'm probably on the dry side, so
Okay.
yeah, so I don't feel like I'm really that oily.
And what was your skin like as a teenager?
Oilier, and I would have breakouts.
And did you have breakouts everywhere? Were they just mild breakouts?
I can't even remember. They were just, it was always, there was something there.
Okay.
But it wasn't like extreme.
Okay. Have you ever been a smoker?
Back in the day, yes.
Okay. So how many years would you say you haven't smoked?
Oh, it's been like 50. About 45 years.
Okay. And how about sunbathing? Were you ever sunbathing?
Yes, we had a pool in the backyard and baby oil in the backyard.
Baby oil and iodine. Now that's just a great sunscreen.
Mm-hmm.
Or cocoa butter.
Yes, oils and and we didn't use sunscreen.
Okay, so mainly as a teenager, then you're going to say you're a sunbather?
Oh yes.
How about in your 20s?
Yes.
30s?
I was getting better.
Okay.
But I still did it.
Not quite reformed yet. Oh, right. Okay. So let me ask you, what do you wash with in the morning?
I just use water in the morning, actually.
Okay. And then what do you do after you use the water?
I put eye cream and I put sunscreen, and then I'll use my makeup.
Okay. And so no moisturizers or serums or anything?
No.
Okay. And the sunscreen, you know what the SPF is?
It's 45.
Okay. And do you recall the brand name?
No, I don't recall the brand name, but it's through a doctor.
Okay. So it's in a physician's office?
Correct.
Would it be a common brand name like Skin Medica or Skin Suticals, or is it more of a private label?
I think it's a private label.
Okay.
I think.
Dr. Morgenroth by any chance?
That's correct.
Okay. So it's from, so I know who makes that. It's California Skin Institute.
Yes.
Dr. Morgenroth is a dermatologist who's really, really famous for his Mohs surgery, and he has lots and lots of locations under the name of the California Skin Institute. Okay. And so during the day, does your face feel comfortable? Does it feel dry at all?
No, not really. Just it's okay.
Okay. And then at night, do you just use water? Or what do you wash with?
I use Bagi cleanser, and because that takes a lot of my makeup off.
Now that's a gel cleanser, is it not?
It's a foamy gel, yes.
Okay. And if I remember correctly, that is for all skin types.
I think so, yes. And I do like it.
Okay. It doesn't make your skin feel dry.
No.
Okay. And then what do you do after the Obagi?
Sometimes, a lot of the times, I will use like Dr. Gross's his glycolic pads.
Oh, the peel pads. How often would you say you do that?
Every other night.
Okay. And then what do you do after that?
My eye cream, and then I just go to bed.
Okay, so no night creams or anything on your face
No.
at all. Okay. And let me go back to the morning. On the makeup, what type of foundation do you use?
It's Armani foundation. It's a
Okay.
liquid.
Is it the Armani Silk or?
Yes, they're
Okay.
yes.
I'm trying to remember. I think that's kind of the name, but I'm not sure I got it
I
exactly
think
right.
you got it perfectly.
Okay. So let's talk a little bit about your concerns. So really what we're talking about here is we're talking about general skin rejuvenation. And I know you've heard a lot of this before, but I'm going to go back and kind of give you a little bit of a foundation and understanding of what we're dealing with here. So most of the damage that we see in our lifetime, it happened before the age of 10.
I know.
And it takes 10, 20, 30 years to show up. But at least 50% of it is programmed into our skin by the age of 20. And it just takes 10, 20, 30 years to show up. I hear all the time people saying to me, well, between the ages of 25 and 35, I really didn't see my skin change much at all. And then all of a sudden I got up one morning and I started seeing these changes, and I started seeing fine lines or textural changes, or my pores look larger, or it looked like somebody took the air out of my face. So again, these are changes that were probably programmed in your skin years and years ago. And the bad news is that you haven't seen the end of those changes, because it's kind of progressive as they begin to show up. Now, the good news is there's a lot we can do for the appearance of that.
That's good.
So I kind of want to talk about, first of all, I want to ask you, where do you think you have lines and wrinkles?
Where mostly around my lips, even though
Okay.
I don't smoke. I have those smoker lines for some reason, and right on the sides of my face.
So crow's feet?
And right.
That's
down
a horrible name, isn't it?
here.
Crow's
I
feet.
feel like one.
And where else? Any place else?
Pretty much, just like right in here, believe it or not. I think it's
Okay.
from sleeping or something.
Well, actually, there is such a thing as sleep lines, and from just depending on if you kind of sleep on the side of your face, it can kind of exacerbate it. And so, tell me about where you perceive sagging.
Right here, I am starting to get jowls,
Okay.
and then around my eyes, definitely.
And when you say around your eyes, you mean under the eye or on top of the or the upper
Both.
lip? Okay. Okay. And then let's talk a little bit about the breakouts along the jawline. I'm going to have you sort of describe to me the type of lesion you get. Do you get a papule that turns into a red bump and sometimes is a pustule? Do you ever get those kind of underground hard ones?
That's what I get.
The underground
underground
hard
cystic
ones.
ones.
Okay, so those are known as nodules or mini cysts. Okay. Are they there all the time?
No, not all the time, no. But when I get them, they're large and they're painful.
And those are the type that take a long time to go away. It's not like you can just squeeze it and get something out.
If you want to squeeze it,
You
then
want to squeeze
can't.
it. If you do, it ends up being just a mess.
Yes, and it gets larger. And
Yes.
Yes.
Exactly. So tell me something. Is there anything that you do that you think makes that better, or anything you do that you think makes it worse?
Well, picking will make it worse.
Okay.
Sometimes we'll do that. Making it better? No, just drinking water. That's all I can think of.
And
just keeping it clean.
are you a milk drinker?
No.
Okay. Do you eat a lot of other types of dairy, yogurt, cheese, anything?
Yogurts.
Okay. Okay, so let's talk about some of this. When we talk about skin rejuvenation, there's generally three things that we address. One is a term that I use called resurfacing. And resurfacing is really where you use a combination of acids or an acid, and you're doing a little bit of that with the peel pads. And Dennis Gross peel pads are a glycolic acid peel pad. And what that does is it addresses superficial skin imperfections, the appearance of things like acne or rosacea or fine lines, pore size. It gives the skin that really smooth, really porcelain-looking glow, and where it just kind of looks airbrushed. And everybody wants that look. You want to look like you woke up in the morning like you were just on the red carpet. The second thing we want to do is we want to address some of the damage, the appearance of some of the damage that happened this programmed into your skin. And hopefully maybe help to prevent some of that from appearing. And we also want to address the damage that's already there. We can do a lot to make the skin look a whole lot better. And so in terms of some of the things that you have mentioned, we kind of have to look at, well, what is really realistic and things that we can address and what are things that we really can address. Okay, so lines and wrinkles on the upper lip, you can definitely soften that. That's a tough one. And even when people go get injectables, if they've got lots of the little lines around here, you're talking about having to do a lot of injections, and it doesn't always last. And I think injectables are fantastic, but that's an area that's just very hard to address. But there are things that we can do to soften that. And one of the reasons why those lines are annoying is because, if for no other reason, when you put lipstick on, it bleeds into the lines. And so there are things you can do, because I'm here to tell you, and I'm going to be 67 in December, and I wear red lipstick, which I have on today, and it never bleeds. So there are things that you can do to help to prevent that and to make that area look a lot better. Now, in terms of crow's feet, okay, crow's feet are what is known as dynamic muscle movement. So you have two types of lines and wrinkles, and you probably know what I'm going to say. But you could live in a cave and never go out in the sun and not have the textural changes and the fine lines and wrinkles on the face, but you would have what's called dynamic muscle movement, and it's for making expressions. So you get parenthesis lines, you get forehead lines, and you get the crow's feet. And it's where some muscles are overused more than other muscles. And so what they do is, using a neurotoxin, with like Botox, they inject in that area. And so the muscles that are being overused are sort of temporarily disabled. And it allows the muscle to relax, because when the muscle is overworking, you put the skin over it, you see a line. So that's Botox. Now we can soften the appearance of that. We really can. We can make a difference. But it doesn't replace Botox. So that's the forehead, that's parentheses, that's the lines around that area. In terms of around the jawline, we can definitely make a difference there. And also, to some extent, in the cheek area. Now, what happens in terms of the aging process? There's actually 3 segments of the aging process. One is hereditary. So heredity, if you want to know how you're going to age, look at mom or dad or grandma or grandpa. And chances are you inherited that bone structure. And bone structure plays a huge part in how you're going to age, because it gives the face shape, and it also kind of holds everything in place. If you look at people who now are in their 80s, like Sophia Loren, she still has these really high cheekbones, and her face is fairly sculpted, because even though she's lost a lot of volume, she has this bone structure. Now, the second area is what we call intrinsic aging. And intrinsic aging is kind of the aging process that really has nothing to do with sun damage. And so some of the things that happen in with regard to that is the cheek pads, which actually, in a face that is highly volumized, in a youthful face, the face is shaped like a triangle. So the widest part and the highest part of the face is the cheekbones. And you have nice high cheekbones. And it goes like this, and you have a well-defined jawline. What happens is that the cheek pads begin to move down. As they move down and that area flattens, you start to see a smile line. Then you see a nasolabial fold. Eventually, the triangle is upside down. The widest part of the face becomes the jawline, and this face part is more flattened. So those are all things that have to do with intrinsic aging. And where we can help with the appearance of that, a lot of that really is cosmetic surgery. Now, the third part of the aging process is what we call extrinsic aging. That's sun exposure. Believe it or not, 90 to 95% of what we perceive as inevitable aging, like, okay, nothing I can do about this. I look in the mirror and start seeing these things. 90 to 95% is sun exposure, and we actually can prevent it or actually can address the appearance of a lot of it. So there are definitely things that we can do. And the other thing is when we talk about the sagging that can happen in where the brow starts to come down, or where we see certain things on the lower lid, sometimes on the upper lid it can be excess fat, but very often it is not. You don't want to remove fat and then that area looks really hollowed out. Sometimes it's a matter of the eyebrow has come down and it's moving the brow up. The lower lid rests on a fat pad, and that fat pad is held in place like a girdle with a membrane, and there's collagen and there's skin, and what happens is it's like when your Spanx start to give out. So it starts to kind of get looser and the fat herniates. And so that's why when they do lower eyelid surgery, what they're doing is they're removing the fat, and if there's a lot of excess skin, they're taking away some excess skin. Today, in many cases, what they do is they actually leave the fat, they just rotate it, because you don't want the area to look hollow, and you want the distance between here and here to actually be somewhat short and just more contoured. So again, those are things that we can actually definitely make a difference in the appearance of fine lines around the eye area, underneath the eye area. We can make a difference, but just realistically, that's what we're dealing with. Even skin tone. This is one that it's not easy to address, but we can definitely address the appearance of that. Virtually 100% of all people over the age of 35 are going to have abnormal pigment. All of us. And even if you escape it on the face, it's going to be on the hands, and eventually it's, you've got some of it everywhere. And so it's a huge issue. And there are things that we can do today that are so much more dramatically effective than what we even had 2 years ago, 5 years ago.
Oh, good.
And in fact, one of our products, which is the Luminant Face Lotion, has actually, there's a study that has been written up in a peer-reviewed medical journal, the Journal of Drugs and Dermatology, which has gone head-to-head with hydroquinone, and we actually won with prescription hydroquinone. So that's an area where we can really do a lot to make the skin look so much more luminous, so much more glowing. And in some studies where they have analyzed what people perceive as aging, you would think that lines and wrinkles would be the #1 marker. But in people that have obvious discoloration, they oftentimes are judged to be older than people with lines and wrinkles. So having even skin tone is huge. Breakouts on the jawline. Definitely we can address that. And it may be just as simple as putting you on a basic program, but there are things that go beyond that. And one of our specialties is dealing, for example, with severe cystic acne.
Oh, good.
So that's something that, and I personally am a 2-time Accutane failure.
Oh.
And I had severe cystic acne, not as a teenager, I had perfect skin, but as an adult.
Oh, that's awful.
So, and I never break out. So there are definitely things we can do for that. Now, so here's what I'm going to recommend for you. And by the way, the reason that I mentioned, let me go back for a second, because the reason that I mentioned about milk, a lot of times people want to know, is diet going to make a difference in my skin? And yes, it does in some ways. We know more about it than we used to. For example, if you eat a lot of inflammatory foods, then aging is actually based on inflammation. And so eating less inflammatory foods and having a very healthy diet can help. But we also know conclusively, and this is a study that was done on something like 57,000 nurses, and it was published in the Journal of Dermatology, that the American Academy Journal of Dermatology, that milk causes acne, dairy causes acne.
Oh, okay.
It is definitely a causative factor. And not only did they do it on all those nurses, but they repeated the study on their sons and daughters, and then they did another 2 separate studies. I think one was like 3,000 girls and 3,000 boys. Now, we usually think, well, this is because we give hormones or something to cattle. No, nothing to do with that. In the US and literally throughout the world, and I don't care whether you buy your milk and it's organic and you get it from Whole Foods, we continue to milk cows when they're pregnant. In nature, if a cow's pregnant, it'll push the calf away. because it knows that it's producing certain hormones at that point that aren't appropriate. And so if you go and take milk off the shelf and have it tested, you can find sometimes, and I can't remember the exact number, it's something like 9 steroidal hormones.
Oh, wow.
Now, it doesn't mean that if you stop having dairy, it doesn't mean that all of a sudden everything clears up. But it definitely plays a role. And what happens is that it can trigger sort of issues with testosterone. So when your estrogen levels start to drop, that can play a role. But even in very young women, you have certain enzymes in your follicle that are harmless. And they're known as isozyme type 1 and isozyme type 2, collectively as 5A reductase. They're harmless. Outside your follicle, you have hormones. Everybody has them: estrogen, testosterone, progesterone. Women have almost as much testosterone as men, but our testosterone is bound by proteins. So it's like got a sack around it, so we don't get a hairy chest and a beard and a deep voice. But you can have a little bit of a testosterone sensitivity. It won't even show up. Or maybe you're producing a little bit of extra testosterone. What happens is it gets together with those enzymes and it produces in the follicle dihydrotestosterone, the most aggressive form. And you almost always see it in this area. You can be anywhere, but it's usually that jawline, perioral, and it's very stubborn. Even women sometimes who go on Accutane will continue to have to deal with this after they've gone off the Accutane. It comes back. So what we may have to do is we may have to do something to kind of block that. And we do have an amazing product that not only de-ages the skin, but also works for acne.
Well, that's good.
And it's got some very good studies behind it. So we always have that kind of in our arsenal if we need to, but we may not need to go to that. Okay, so here's what we're going to recommend for you. We're going to start you off on our basic skincare management system. Now, the one that I'm going to recommend for you is a normal combo system, and here's why. If you had said to me, "Gee, Jan, I'm kind of really on the dry side," and you were using the products that you're using, I would probably still put you on the system because you're not really using any emolliency or anything. And if somebody says to me, "I'm really dry," and they're using a lot of different creams and they're using a lot of different emollient products, then obviously, if their skin still feels dry, they're definitely on the drier side. So sometimes, even though you may think you have a certain skin type, it may not be as normal or it may not be as dry as you think it is because you're not really, you're not doing a lot to lubricate it, so to speak, or doing much topically. So I think this is going to be way more in terms of moisture and topical kinds of things than what you're using. Now, this is going to be, this is a glycolic acid cleanser. And one of the things about glycolic acid, you can have the best cleanser in the world, but it doesn't matter how good it is, it can't get inside your follicle. And the follicle is where you have follicular retention. And people always complain about larger follicles, and they complain about clogged pores and those kinds of things, and particularly acne. Glycolic acid has a smallest molecular weight of any alpha hydroxy acid and can get into your follicle. This is a very, very gentle cleanser. We also have a lipid-soluble vitamin C. This is going to play a huge role because it has something in it called dimethylaminoethanol, which can make a huge difference in the appearance of sagging skin. And there's actually, this has been presented at the American Academy of Dermatology. Also in here is a product called BioClear. And BioClear is glycolic salicylic and azelaic acid. Not only is it amazing for the appearance of breakouts, but it is a resurfacing agent that really makes the skin that really glowy, glassy, refined look, fine lines and all of that. It makes the skin look a lot brighter. And then we have something in here called Transformation. And Transformation would be like a cream hydrator. It has something in it called Transforming Growth Factor Beta 1. Which has to do with the appearance of the skin. And Dr. Weedo of Jefferson University actually commented, and he said this is just a thing to keep the skin young indefinitely. It has transforming growth factor beta 1 in it, among other things. And finally, the sunscreen. Now the sunscreen is a broad spectrum sunscreen. This covers the entire spectrum. So you can have a sunscreen that is an SPF 100. It doesn't mean it covers the entire spectrum. So this is something that gives you the best protection that you're going to be able to get in terms of covering UVB and UVA. But in addition to that, it also has an oil capture system. So let's just say that there are times where maybe it's humid and your skin feels a little bit more oily, or it feels more dry. It actually has the ability to have an almost unlimited ability to pick up oil off of the skin without picking up water or actives and really balancing it out. But on the other hand, any place where you're dry, it gives you that beautiful, glowing, nice, dewy look.
Wow.
Okay? So that's going to be your basic system. Now, in addition to your basic system, I'm going to have you using our Marini Luminant Face Lotion. This is specifically for discoloration, but it's also an anti-aging product.
Oh, great.
So this is a product that has retinol in it. And retinol is a game changer. You know, retinol and glycolic acid are the two topical agents that have more medical data than virtually anything else ever that's been in the marketplace. And this has a lot of data on it. And you're going to find that this is a very aggressive form of retinol, but the good news is that in the study that was done by a dermatologist in Northern California, 76% of patients had no side effects.
Oh, that's good.
So even if you were using the lowest strength of a prescription retinoid, you typically have an acclimation period. But this also has all of the other kinds of things that help with the appearance of discoloration. Now, there's some other things that probably I'm going to get into. Well, first of all, I'm also going to give you a Luminant eye gel. So I'm writing this down. Normal combo skin for your basic system. Luminant eye gel for under the eye area. Luminant eye gel is one of my favorite products because it was actually designed for people that have dark circles as well as fine lines. I don't have dark circles, but it really does illuminate and make that eye area look so much smoother. And it doesn't do it because it's got reflective elements in it, like some things you put underneath your eyes and they've got mica and they just sort of reflect the light away. It really does change the way that the eye area looks. Okay. And finally, the one thing, well, actually what I'm going to do, there's some things that we're going to think about for the future. Our Hyla 3D, which is our hyaluronic acid product, and a couple of other things. But first we're going to get you on the basic system and get you acclimated to this, and then we'll revisit it. So do you have any questions for me?
No, I'm very excited though.
Are you excited? I'm
very
excited too. I can't wait to see what happens. Well, thank you so much for tuning in. I'll see you again later. And oh, don't forget to subscribe. Bye.